All right, we're diving straight into one of those high stakes, life or death situations that first responders face. This is all about critical thinking when the clock is ticking, and a single decision can change everything. Let's get right to it. So, put yourself in the moment. You're on scene. The dispatch was for severe abdominal pain. You find a woman, she's awake, she's talking to you, but she is in serious distress. She's restless, can't get comfortable, and she uses a very specific word to describe the pain: tearing. Right away, you know this is serious. You manage to get just one piece of medical history out of her, but it's a huge clue. She has a history of hypertension. High blood pressure. Let's just file that away because it is incredibly important. Okay, now you get a set of vitals, and whoa, look at that blood pressure. It's way down in the danger zone. Her heart is just racing to try and keep up, and her breathing is fast and shallow. These are classic blaring alarm bells for shock. So with this picture, you've got 4 possible moves you can make right now. First up, option A, hit the pain head on. She's clearly in agony, and fentanyl is a potent painkiller. Seems compassionate. Seems logical. Why let her suffer, right? Then there's option B. Let's treat that scary low blood pressure. Basic emergency medicine, right? BP is low, you give IV fluids to bring it up. It's a textbook response to stabilize someone in shock. Okay, option C. Get your hands on her and do a physical exam. You could feel for a pulsating mass in her abdomen. That could be a huge diagnostic clue. Maybe an aneurysm. Makes sense. And last, we have option D. This one's a little more subtle. Check the femoral pulses down in the groin and see if the pulse on the left side feels the same as the pulse on the right side. It's not as direct as the other options, is it? So there you have it, 4 choices: pain meds, fluids, a physical check, or a pulse comparison. What's the right call? What's the move that gives this patient the best chance? The clock is ticking. And the correct answer, the one that could save her life, is D. Check the femoral pulses. I know. It might seem like the least obvious choice, but there's a critical reason why this simple check is the absolute priority. It points us directly toward a very specific and very deadly diagnosis. What we're almost certainly looking at here is an abdominal aortic dissection. Think of the aorta as the main water main coming out of your heart. A dissection means the inner lining of that pipe has torn. Now, blood isn't just flowing through the pipe, it's forcing its way into the walls of the pipe, splitting the layers apart. It's a plumbing catastrophe. And here's why that pulse check is the key that unlocks the whole puzzle. As that tear rips down the aorta, it can block off the arteries that branch off to the legs. If it blocks one side more than the other, you get a weaker pulse on that side. That difference between the left and right pulses, that's the telltale sign, the smoking gun, for an aortic dissection. Now, knowing the right move is one thing, but it's just as crucial to understand why those other options, the ones that seemed so logical, would have been absolute disasters. Let's just walk through the mistakes. If you push hard on her abdomen, you could actually make that tear worse. No way! Give her fentanyl? With a blood pressure that low, a powerful narcotic could tank it completely. And just blindly pumping her full of fluids to get a better number on the monitor? Well, that misses the entire point of what we're trying to do. And this brings us to the real lesson here. We don't treat numbers, we treat patients. The goal isn't just to make the blood pressure number look prettier. The real goal is something called perfusion. This is the key concept. Perfusion just means getting enough oxygen-rich blood to the vital organs, the brain, the kidneys, to keep them from dying. And the best way to know if that's happening isn't just a number on a cuff. It's checking if the patient is thinking clearly and if you can feel good, strong pulses in their hands and feet. That tells you the system is still delivering the goods. So, what does this all mean in the real world? It means you're constantly assessing her mental status and feeling for those pulses. You get a big IV line ready to go for sure. But you only give fluids if her perfusion, her mental status, her pulses, starts to get worse. You're not chasing a number. You are supporting the system just enough to keep the organs alive. And that's really the big takeaway, isn't it? In an emergency, knowing what not to do can be every bit as life-saving as knowing what to do. Resisting that urge to give a painkiller or blindly push fluids was the key. And it kind of makes you think, doesn't it? What other obvious medical treatments or assumptions should we maybe take a second look at?